I am Dr Swarupa Mitra, radiation oncologist. Today we are going to talk about how to prepare for a radiation treatment. So you have been diagnosed with cancer, you have gone through the biopsies and all the investigations needed, and your doctor has suggested to you that a radiation treatment needs to be taken. The initial consultations have been done, you know how it is going to be done, you have understood all the ways to do it, the side effects, but now the date has been given to you that you need to start your radiation, and that is where today's topic begins. Although you know about how it is starting and how it is going to be done, there are so many apprehensions in the mind as long as it does not start. So you have to prepare for many things, not only about yourself, your food, but also your household, your neighborhood, your remaining life and everything else. Before you start the treatment, when your date has been given for the treatment, the first thing you need to do is to assess your household, to assess your work which is pending, assess your responsibilities. So initially, I would suggest that make a list of what are your responsibilities which are pending during the 5 to 6 weeks of radiation therapy. So make a note of them and try to postpone them, or if you can do them online, complete your responsibilities, that is also okay. The basic idea is not to take any stress regarding any pending work. You may have children who would be depending on you, or maybe you have some older relatives at home, so you need some help in the form of a hired help or your relatives who can take care of your children or your older relatives who are depending on you. After that is cooking and household errands. So they too need to be managed accordingly with the help of some help. So you need to continuously concentrate on your treatment and on yourself, keeping yourself healthy and positive throughout the treatment. After this is done, then you are preparing yourself for the treatment, which is the next day. So there are a lot of anxiety, so try to relax. Just relax yourself and think of all good things, think of your hobbies, plan something to do after the treatment is done, so that leaves you to look forward for something after the treatment is done. So it makes the treatment, the journey of the treatment much easier. The night before the radiation treatment, have very light dinner and light food, take a lot of fluid. Try to sleep a little early, try to relax, maybe watch a movie with your partner or with your children, or read a book, take a stroll outside, watch a small movie, so they will keep you relaxed the night before the treatment. I am saying all this thing, but I am sure after the treatment is done, you are going to feel it is a cakewalk, it is easy, it does not really require so much of stress. After the night is done, the next day you are ready to go for the treatment. You must have been given a time for the treatment. So try to reach about 15 minutes before that scheduled time. So when you go to the hospital, be prepared with a few things. If you have been given a time, be prepared for the first day. It will take time. You be prepared to wait in the hospital for about 2-3 hours maybe. So maybe you can carry with yourself some snacks, some water, some drink, or some books to keep you busy during the waiting period. Do take somebody with you, maybe your partner or your children, who will be with you to follow and listen to the instructions which the doctor gives you on the first day. So next day, after the night is done, you are ready to go to the hospital. After you reach to the hospital, the first thing you will be doing is meeting the doctor once again, the doctor and your radiation oncology team. You will need to meet them, and they will once again, they will repeat the entire instruction, all the do's and the don'ts, the food you will take, the reactions you may expect. So all these things they are going to repeat to you once again. I am going to talk about the reactions and what to expect in another video. This video is only for how to prepare yourself for the first day and during the treatment. So after this, when you go to the doctor, be ready with a few points. You may note them down, that what you forgot in the initial assessment or in the initial consultation. So note them down and be ready to ask them. Even if it is multiple times, please ask to your doctor, because the doctor will be too happy to explain to you all your doubts, even if it is more than once. So after you are absolutely clear about the treatment, what to expect, you have a brief chat with your doctor, then you will be taken to the radiation machine. So the first day going to the machine does take time, because they have their own optimizations and different processes which are done before the patient is taken up on the treatment machine. So maybe you will need to wait for some time, maybe half an hour or an hour or so, before you are actually taken up on the machine. The first day or during the treatment, it will be advisable to wear something very light, which is easy to remove and which breathes, maybe cotton, something, because when you go there, they are going to remove your clothes and you change into the hospital garment. So something which is easy to remove and change would be more comfortable. So after all this is done, finally you are being given a call that your time has come to begin the radiation. And then a doctor will escort you, and there will be entire team. It is not the doctor. Many times the patients ask, is the doctor going to deliver the radiation? No, it is a radiation oncology is a teamwork. So you have a full team of technologists and physicists along with the doctor who takes care of you on the machine. So the first day when you are taken on the machine, it is going to take some time, because the cast which was made for you has to be reset to see that it fits you well. The markings need to be done once again. The scans on the treatment machine needs to be checked once again. And then finally the treatment begins. And before the treatment, the radiation technology team and the doctor's team, they will explain to you that during the treatment you are going to be alone in the treatment room, but nothing to get worried about, nothing to get scared about, because there is a closed monitoring system, a CCTV camera which monitors you even when you are inside and there is no one else with you. In case you have some difficulty, suppose you want somebody to come in, you can raise your hand and immediately somebody is going to come and attend to you. So this is all about the first day of the treatment. I am sure this is going to help you, and in case you have any questions, you can always send them in the chat box. Thank you and wish you all the best for the radiation treatment.